Hello, this is Dr. Mercola, and today I'd like to talk to you about a very common reason why many people visit physician's office in the U.S. at least, and that's over 20 million people every year, and that is arthritis. Now, arthritis can be divided into two primary types. One is osteoarthritis, or degenerative joint disease, DJD, or the wear and tear arthritis. The other is rheumatoid arthritis. They are completely two different animals, but the only similarity is they affect the joints and they can be connected with joint stiffness, pain, and inflammation and swelling. So, but other than that, there's two different causes. Now, the osteoarthritis is typically in older individuals or in people who have repetitive stress or some type of acute trauma, whereas the rheumatoid arthritis can affect just about any age and does in fact infect children. That's called juvenile rheumatoid arthritis, or JRA. Unfortunately, that's relatively rare. Now, let me tell you how I can distinguish between the two so that you can know which type you have. Now, degenerative joint disease usually affects the distal, or the joints on the end of the fingers, not the middle ones. And in fact, if you have a little swelling there, it's called a Heberden's node. So, and it's also not symmetrical, so that you can typically only have one joint. So if you have it on one hand and not the other, or one foot or one knee, it's much more likely to be degenerative joint disease. Rheumatoid arthritis, however, is an autoimmune disease, and it's the body's breaking itself down. So because of that, it tends to be bilaterally symmetrical. So it's the same on both sides. It also affects the middle joints, and it would typically the hands, the fingers. It's associated with joint deformities, and it can be very crippling. And people, as I said, do die from this. It's a real challenging condition. Now, some of the treatments are very similar for both because, as I said, they both involve joint pain and swelling inflammation. So the typical anti-inflammatory approaches, or non-steroidals, or analgesics like Tylenol can be used. And this will relieve pain, and there's a lot to be said for pain relief. It's very important to understand that the regular chronic use of these medications are associated with significant, very serious side effects. Typically can result in liver or kidney damage, and it's a very common source of kidney failure in the United States, is the use of these analgesics. So it's vital that you understand and seek to find the cause of the problem. And let me go, and there's a number of different ways that you can do this. You clearly want to see an experienced professional with this, and so they can at least give you a diagnosis. With respect to treatments, though, there's some commonalities, even using natural approaches, and one of them is going to be the use of omega-3 fats, a high-quality source of animal-based omega-3 fats, because that's really an essential component and a factor so that your body can reduce the inflammation. There's a very complex pathway that involves prostaglandin production and secondary inflammation, and these essential fats work in that. In fact, that's how some of the non-steroidal anti-inflammatories work. They work by interfering in those pathways. So you can easily manipulate that with the foods that you're eating or the supplements that you're taking. So that's the number one thing. And then, of course, you should be eating for your nutritional type. So you want to get that macronutrient ratio, the complex coordination between how much fat, protein, and carbohydrates you're taking is really based on your specific and unique biochemistry and genetics. So if you don't know about nutritional typing, you certainly want to look that up on the site. Now, there are some symptomatic approaches that you can use, and one of those, especially for osteoarthritis, would be glucosamine, and although that's useful, it's more like a Band-Aid. It's not really going to treat the underlying cause or condition, but it's certainly safer than using a medication. One of the treatments that I found particularly useful is boswellia, and that's an Indian herb, and it's used very effectively to treat joint inflammation, but it's not treating the cause. You can also use acupuncture, another safe and typically effective forms of treatment. So these are all tools that you can use to reduce the pain, inflammation, and swelling. But when you get to rheumatoid arthritis, as I said, the pain and crippling and deformities becomes much more severe. So typically much more aggressive medications are used that really are some of the most dangerous that we use in medicine. High doses of prednisone are very common. People are put on immunosuppressives and anti-cancer agents to treat the pain and the swelling. And it is significant. That's why they resort to such serious measures. But in my experience, it's been significant because I started using a protocol that was developed by Dr. Thomas Brown in the late 80s, so literally over almost 20 years now. And with this treatment, we've treated over 3,000 patients, and I would say we have an 80 to 90% success rate with this protocol. If you'd like more information, just type that in on my site and you can find the protocol. But that was, Dr. Brown's approach was that this disease, rheumatoid arthritis, was based on this infection, typically by mycoplasma. So antibiotics were used. And I had a fair amount of success when I was using that, but then through the years I've developed modifications that as my knowledge and information about human health increased and I started to understand some of the contributing factors, the improvement improved significantly also. And that is basically that some of the pearls are that any autoimmune disease hasn't, for the most part, two primary considerations. One is that there's almost universally a vitamin D deficiency. So typically the epidemiology is really clear on this. In other words, the further you go away from the equator, the higher the incidence of this disease becomes in that population. So the important substitute is, of course, is to make sure that your vitamin Ds are optimized. And I think it's virtual criminal malpractice and negligence if you have an autoimmune disease, specifically rheumatoid arthritis, and if you're not checking your vitamin D levels regularly. And they've got lots of information on the site on how to do that and how to optimize your levels. So that's one key thing. But then the other that I've noticed is that there's almost universally in these autoimmune diseases some type of predisposing traumatic emotional insult that typically occurs before the age of 5 or 6. And unless that specific insult is addressed and some type of effective therapeutic modality, then the underlying trigger for that is not going to be removed, and the continuing physiological destructive process will proceed. So it's very important to have a tool to address that. In my practice, the most common treatment we use is a form of psychological acupressure, which is called emotional freedom technique, or EFT. So those are really key. And you know, when you combine these, and especially in the hands of a skilled clinician, with some of the safer modalities to treat and alleviate the pains and symptoms, I think you can make some great progress. So it's really important to have this understanding because you know, arthritis is such a common problem. So this video doesn't just allow us to go into more detail. So if you want more information, please look at some of the articles that I have on my site, because they are designed as tools to give you and your family the information, the resources you'll need to take control of your health.